Probe design. Calibrated periodontal probes are marked in millimeter increments. These instruments are used like miniature rulers for making intraoral measurements. Indentations or grooves, colored indentations, or colored bands may be used to indicate the millimeter markings on the working end of the probe. Different probes have different patterns of millimeter markings. Each millimeter may be indicated, or only certain millimeter increments may be marked. For example, the UNC 15 probe shown here has millimeter markings at 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15 millimeters. Some probes have millimeter markings only at certain millimeters. For example, this probe has millimeter markings at 1, 2, 3, 5, 7, 8, 9, and 10 millimeters. Note that there are no millimeter markings at 4 and 6 millimeters. This probe has colored bands instead of individual millimeter markings. Each band is 3 millimeters in length. The millimeter markings on this particular probe are at 3, 6, 9, and 12 millimeters. Practice, you will be working on the mandibular right first molar. Before beginning, take a moment to self-assess your position and your patient's position. Correct them now if needed. Throughout this technique practice, stop every so often to reassess position and grasp, and correct them if necessary before proceeding. Insert the probe into the sulcus near the distofacial line angle of the first molar. Keep the side of the tip in contact with the tooth surface as you gently slide the probe to the base of the sulcus. Begin to probe site 1. Keeping the tip in contact with the tooth, initiate a series of short, bobbing strokes toward the distal surface. Use a walking stroke, keeping your strokes close together. Walk the probe across the distal surface until it touches the contact area and pause here for a second. Tilt the probe so that the tip reaches beneath the contact area. Gently press downward to touch the junctional epithelium. On this typodont, the gingival tissue and second molar have been removed to provide a view of the distal surface of the first molar. Watch as the clinician walks the probe onto the distal surface until it touches the contact area. To assess beneath the contact area, the clinician tilts the probe so that the tip reaches beneath the contact area and gently presses downward to touch the base of the sulcus. After probing the site 1, reinsert the probe at the distofacial line angle. Make a series of tiny walking strokes across the facial surface, moving in a forward direction toward the mesial surface. Walk the probe around the mesiofacial line angle until it touches the mesial contact area. Tilt the probe and extend the tip beneath the contact area. Press down gently to touch the junctional epithelium. Begin by inserting the probe at the distofacial line angle. Walk the probe across the distal surface until it touches the distal contact area. Tilt the probe slightly and extend it beneath the contact area. Press down gently to touch the junctional epithelium at the base of the sulcus. Reinsert the probe at the distofacial line angle. You are now in position to probe the facial surface. Make a series of walking strokes across the facial surface. Walk across the mesial surface until the probe touches the contact area. Tilt the probe slightly to probe beneath the contact area.
Probe like this in walking strokes around to the buccal. Now, often we take a buccal reading right in the middle here. But if there is a deeper pocket, for instance, if I came around and this was all about 2 or 3 millimeters, and then all of a sudden it drops to 4 or 5 here toward the mesial, we would record the deepest reading on this surface. So you probe from distal line angle to the mesial line angle, and you take the deepest reading and record the deepest reading there. But usually if if it's even across here, and you're not sure of that, but if it's even, you take a reading and pause slightly at the buccal to take that buccal reading. The Nabors number 2 probe, I'm going to use a modified pen grasp and establish a light fulcrum on the occlusal surfaces of the mandibular right premolars. We'll start on the 3rd molar. I'm going to rotate the handle out buccally a little bit to make sure that the terminal part of this working end of the Nabors probe is against the tooth. I want it to be rather flush as I enter subgingivally, and you will have already probed this area with a normal or regular periodontal probe. Now the Nabors probe is very curved, so it's used to detect furcation invasions. First you can go vertically and then use a little horizontal stroke like this, move it horizontally to find the furcation area, the space between the 2 roots on this molar. And then you're going to rotate this instrument in your fingers with your thumb to try to catch the tip of this in between the roots. Now, if this probe goes in 1 millimeter and you can actually catch on the roof of the furca or the ceiling of this furcation invasion, then this is a class 1 furcation invasion. Let's go to the 2nd molar. Keep this adapted, and now let's rotate and enter into this furcation involvement. It's going at least 2 millimeters, and when you're in, say, 1/3 to maybe a halfway across the tooth, you probe gently to see if this is through and through, or if the bone loss has occurred all the way through. Now, I'm stopping here, which indicates that there's bone and tissue that has not been lost in this area. So this is a class 2 furcation invasion. It doesn't go through to the other side. Now, when we progress to the 1st molar here and try to detect the furcation here, we're going in and it's going at least halfway across, and if I adjust this and roll it in my fingers, it's going all the way across toward the lingual side. Now, I'm not quite sure at this point whether there might be a little bit of bone left, but I don't think so. I'm going to rotate or turn this instrument over end for end to use the lingual side of this Nabors probe to enter from the lingual side of the furcation, and yes, it goes more than halfway across, and the probe is coming through. So this is a through and through class 3 furcation.